Welcome. I'm Liana Lianov, and this is the Lifestyle Medicine podcast series for RCSI University of Medicine and Health Sciences, where we're covering all aspects of lifestyle medicine. And today's topic is very important all across lifestyle medicine, which is health behavior change. And so I'm delighted to have as our guest today Simon Matthews, and he's a psychologist, a certified health coach, and he consults internationally on this very topic of health behavior change. So welcome, Simon. So as we dive into this topic of health behavior change, there are a lot of theories around how we make behavior change, and some very common theories can help us understand the process. So please share with us some of these common theories and what they have in common and how they're different. What can we learn from them?
You're absolutely right, Liana. There are a lot of theories, and I'm going to say something about that shortly. One of the most common theories in the field is what's called the health belief model, often abbreviated to HBM. And it's a framework that seeks to explain why we choose the actions that we do, why we take the steps that we take in relation to our health and our own well-being. The elements that sit within the HBM are that we make assessments of the potential severity of a health issue. We make some assessments for ourselves of our likely own susceptibility to that particular health issue. We make some assessments about the benefits of taking action and also the barriers to taking that action as well, the things that might get in the way or inhibit us. So the HBM suggests that across those four broad areas, the severity, our susceptibility, the benefits and the barriers, we make ongoing assessments and therefore shape our health behaviours in that way. The HBM has often historically been used to shape public health campaigns about health behaviour. And that's why public health campaigns, for example, often use figures like a certain percentage of people are going to be susceptible to this disease, or if you manage this disease, you've got an X% chance of swift recovery, and so on. So it makes use of those features. The second theory that's probably quite common, many people possibly have even heard of it, is it's commonly called the stages of change model. Its correct name is the trans-theoretical model of change, and it describes the process of change that people go through when they're making behavioural changes, and particularly health behaviour changes. So it identifies 5 broad stages of change that begin with not even having contemplated a change, not even having considered it, or perhaps having considered it but dismissed it as not relevant to me or not wanted by me, through to the process of considering, contemplating this change. Maybe I could, maybe I will, through to preparing for the change. I think I will do this, and I'll start taking some steps towards making that change, through to what's called the action stage. This is now where I'm starting to commit myself to regular occurrences of this new behaviour, all the way through to what's called the maintenance stage, which means that I've been continuing in this altered or changed behaviour now for quite some time. And it really emphasises elements like self-efficacy, our sense of our ability to do and achieve what we want to. It emphasises ideas around the relative benefits and disadvantages of making particular changes, and also the processes that we go through in making those. So that's the TPM, the trans-theoretical model of change, or the stages of change model.
It's a very commonly used model, so thank you for the nice description.
It is. It's very common. Yeah. One of my favourites is called social cognitive theory. It's largely the work originally of a gentleman named Dr. Albert Bandra. Bandra was a psychologist who passed away relatively recently. And social cognitive theory is interesting because it grew out of a largely behavioural focus in the field of psychology. So Bandra introduced these ideas and really became a proponent of the ideas that our thoughts our interactions, our social interactions in the environment in which we live all shape our behaviour. Social cognitive theory suggests that we can learn through observation, that we can learn through modelling of others, that we can in fact learn by applying successes in other areas of our life to current areas that we need to make a change in, and that we learn through the process of simply reinforcing desired behaviours. So social cognitive theory itself really emphasises the idea of self-efficacy that we mentioned a moment ago, and self-regulation in shaping our health behaviours. And the fourth one that's fairly common, and I also really appreciate this model, is called the social ecological model, often abbreviated again to SEM. The reason I like this is because it places health behaviour in a system. It recognises that we don't, as individuals, simply make unilateral changes to our behaviour regardless of what's going on around us. We are all influenced by multiple factors in our daily lives, including our own thoughts and beliefs and attitudes, including the relationships that we have with people around us, including the communities that we live in and the resources that we may or may not have available to us, and including other broader societal and cultural factors. And therefore, the social ecological model suggests that we need to maintain an awareness of and an action in all of those areas in order to effect lasting behavioural change. So each of these four major theories has a slightly different perspective, a slightly different emphasis. No one of them is better than the other. They all look at slightly different things. Some of them have a more individual focus. Some of them have a more systemic focus. Some of them focus more on behaviour. Some of them focus more on cognition. And
yeah, they each have something to contribute.
Exactly,
but it's not the big picture, because the big picture of behaviour change is complex.
And that's exactly right. It is complex. and here's the thing about that. Back in 2014, so about 10 years ago, Rachel Davis from University College London and several of her colleagues published a paper in Health Psychology Review, and it was a scoping review of behaviour change theories. And what I love about this particular scoping review is that when you read the introduction, they talk about having identified 82 behaviour change theories. 82. We've talked about 4.
No,
82 behaviour change theories.
Amazing.
But then when you get to the conclusion, they write about the 83 theories that we've just reviewed, which always conveys to me the idea or the impression that simply during the course of writing this paper, someone else invented another behaviour change theory that they included. So it is a complex field with a lot of moving parts, and it's valuable to be able to understand behaviour change, I think, from a number of those different perspectives.
Yes, it's complex and challenging, and all of our listeners, I'm sure all of us experience the challenge when we set out to do some changes on behalf of our health and well-being. It's one thing to know what to do. It's a completely another thing to actually be able to do it. And so we all can relate to that. And so we can understand how research and experts in this area are really struggling to get to the heart of what is it that's really gonna, what is the magic that can really move someone forward? And I don't know, what do you think these have in common that might get close to that level of magic?
That's a great question, Liana, and it's not explicit in any of the theories, but I'll introduce another idea here called the common factors theory of change. Common factors research has been around for many decades now. So, for example, when you read about vehicle accident statistics, you might read that there are maybe 3 factors that account for most motor vehicle accidents, and they're typically things like speed, alcohol, and fatigue. And that's arrived at through essentially common factors research. that same field of research has been applied to behavioural change. And what we find is two factors in particular that consistently present themselves as having a very, very strong shaping influence on outcomes that patients might experience. The first of those is the existing resources that the client or the patient actually has. So what they bring to the party, as it were. And on top of that, their own capacity to continue to develop other resources, even with some external assistance from a provider. So it's those internal capacities that's the first major factor. The second major factor is the capacity of the clinician or the provider to be able to develop and cultivate a warm, interested, and curious relationship with that person. So to really kind of, if you like, click with the person in some way, so that person feels like they're supported, they're valuable, they're being encouraged, and so on. And when we get those two things in place, that accounts for a lot of the success that people have, independently then of which particular theoretical model or orientation you may use.
Yes, yes. So that might speak a little bit to that magic. So thank you for that.
Yeah, that's right. That's the magic. That's the kind of dust that gets sprinkled on top of the theories. Yeah, exactly right.
Yes. And so then when we set out to develop, there's this term action plan that we often use. We set out to make a change. There are very specific sets of guidance that's either in self-help books or also in more formal counseling between a coach and a client or patient. Eventually, they get down to the specifics of the steps of making the change. So tell us a little bit more about that.
Yeah. So ultimately, I mean, you're absolutely right. Ultimately, a behavioural change is dependent upon the clarity of a plan, or mostly dependent upon the clarity of plan. Some behavioural changes are a little odd and can occur spontaneously, and I've got a couple of examples of those in my own life that I struggle to explain in these terms. But most behavioural changes are dependent on a plan and dependent on executing that plan. And this is directly analogous to lots of other things that we do in our daily lives. So, for example, if you live on the Pacific coast of the US and you decide to travel to the East Coast, maybe to visit family or maybe to visit a particular location that you've been wanting to visit, at some stage you plan out that trip. You think about, for example, where your overnight stops are going to be. You think about the distances to travel each day. You think about the amount of time that you might be driving. You give consideration to where you might refuel your vehicle, to where you might stop for food and refreshment, for comfort breaks and so on. So at some stage, we need to drill down to that level of planning. And the acronym that's often used in goal planning of that sort is SMART. S-M-A-R-T. Depending on which school you went to, that generally stands for specific, measurable, actionable, relevant, and time specific. So that means having a really high degree of specificity to the goals, setting it up in steps or stages that you can track closely, measure your progress against, making sure that those smaller steps relate to bigger steps, and I'll say some more about that shortly, and making sure that they're things that you can actually do in that moment. And when you have all that in place, generally speaking, you have a good plan. But that's the kind of behavioural activation level of the plan. The other important thing, I think, is to remember the idea of having, if you like, nested plans. So those behavioural changes that you might make, those day-to-day things that you might do, need to be nested in your desires, in the needs you have, and in the vision that you have. If I'm traveling, for example, from Los Angeles to New York, I need to keep New York in my mind. That's where I want to end up. that's being there is what's inspired me to take this trip. So I need to keep thinking about that at some level, and I need to make sure that all those plans that I've made about rest stops and meal stops and fuel stops are actually getting me to the place that I want to be. If I lose the connection between those two things, then all I'm doing really is enacting some particular behaviours that are going to feel less and less relevant to me. If I forget why I'm making the trip, if I lose sight of why I'm making the trip, all I'm doing is driving my car, stopping for fuel, stopping for food, stopping for sleep, driving my car, stopping for fuel, and so on. So it becomes rote, it becomes monotonous, and at some stage, I'm likely to give up on it because I've lost that connection. So for me, behavioural change plans are important, and they must be nested within, a bit like those tables you sometimes find in people's living rooms, or the I forget the name of the dolls, but those dolls that are one inside the other.
The nesting dolls, yes.
Yeah. So each of these things sits inside something slightly bigger and slightly broader.
And those are crucial pieces that help us, to use your analogy, go down that road to our destination. Very important to have all those supports and pieces in place. And that's that behavioral activation and really beginning to do through small steps, getting to the ultimate goal. And then we're doing this particular behavior. But that's quite different than maintaining that behavior. And you were talking about the stages of change and how there's also the last stage is maintenance, right? These are health habits that we ideally want to keep for a lifetime. And so it actually it's a behavior change that we actually want to become a habit, but we're not quite there yet. How do we actually build habits?
Yeah, it's a wonderful question. So, if we keep using that analogy about making a journey from one place to another, at some point we need to connect with new needs, new desires, new visions for ourselves. So the visions that first served us, or the needs or desires that first served us, don't always maintain us into the future. So, for example, if you think about Sir Edmund Hillary, who was the first European, as far as we know, to climb Mount Everest. Maybe other people did it before and it wasn't recorded, but Edmund Hillary set out to be that first person. But once you've done that, once you've been the first person, you can't be that first person anymore. Now, he went on to continue climbing, lots of other mountains, but the motivation has to change. There has to be a different reason for doing it, because that first reason has been ticked off. So once I arrive in New York, using our analogy from earlier, then I need to connect with different things that might keep me there, different things that might sustain me there. Maybe that's, falling in love with the architecture and wanting to explore that. Maybe it's a particular lifestyle. Maybe it's the capacity to do things there that I perceive that I can't do in other places, and so on. So whatever first took me to that change is not likely to sustain me in that change, and I need to take some time to reflect on what that might be. The other dimension, I think, of building those habits is, first of all, having what I would call an experimental mindset. This is really, really important for anyone who's been making an effort for some time to make a behavioural change. Liana, I used to do some work some time ago with people having bariatric surgery, so weight loss surgery. And commonly, the people that I was working with had been endeavouring to manage their weight for many, many years, sometimes decades. They had decades of experience of feeling like they tried and failed, tried and failed, tried and failed. And that turns into a mindset of boom and bust, boom and bust. It's a really black and white kind of either or. Instead, one of the things that we need to encourage is a mindset of experimentation. And if you think back to, chemistry labs at school, you did experiments in the chemistry lab. to see what happened, and you would write a report describing what you observed happen. There's no right or wrong to a chemistry experiment. It just is what it is. You get what you get, and you report what you get. And that same mindset is helpful in health behaviour change, to approach things experimentally, to say, well, I'll apply this, and I'll see what happens, and I'll see where it gets me. And wherever it gets me, I now have an opportunity to learn something. I've learned perhaps about a new strength that I had, or a new ability or capacity. I've learned about something, learned about a barrier that I wasn't anticipating. I've learned about my capacity to manage that barrier. I've learned that this got me some of the way, but it's not going to get me all of the way, and so on. So having that mindset shift is really important. Beyond that, oh, sorry, go ahead, Liana.
Yeah, no, I'm sorry to interrupt. As you're thinking, as you're talking, I'm thinking that it's like being a third-party observer, because if we get too emotionally involved, then that can really backfire for the change that we're trying to make. But to stay back a little bit, observe what those lessons are, and you gave some of those examples, and then pick the kernels from those, the best pieces of those lessons to apply and make changes in order to be successful.
Yeah, that's exactly right. There's a lovely point that you've made there, Liana, about endeavouring to adopt an observational perspective of ourselves. So in a sense, for example, at the end of the day of, perhaps working towards a particular behaviour change, to sit down and kind of replay the day in your mind almost as a film, and see yourself out there, not as yourself, but see yourself as the player in this film out there. Observe what you did and become aware of what you did. Be curious about what you did, and that can be a helpful mindset. The other two things, or three things, I'm going to say that are important here. Staying connected to the needs that you have. Healthy habits are built on satisfying needs, and if we lose our connection to those needs, then we lose that opportunity to build those habits. The second factor, of course, is immersing yourself in an environment in which you're going to have opportunities to do this. And then the third element is actually practicing. So actually doing, practicing the skill that you want to practice. So all of those three things kind of need to come together. We need to connect with our needs. We need to deliberately and consciously place ourselves in the environment which is going to help us satisfy those needs, help us engage in that behaviour, and we need to choose to engage in the behaviour. And when all of those things happen together, then we're on the pathway to building a new habit.
Yeah. Yes. So that intricacies of making sure all those components are there are absolutely essential. And we've been mostly talking about adding habits, as we might want to add more fruits and vegetables to what we eat. We might want to add another physical activity, or add strength training if we're only walking, or some of the really basic and important healthy lifestyles that we all can benefit from. But there's a different part of behavior change, which is getting rid of bad habits. So we might be adding the vegetables, but we might have a tough time getting rid of the French fries, for example. How do we do that? What are the nuances? Because that's, I understand, more difficult. And related to that, there's this habit loop, and how does that relate to bad habits, and what can we learn from that and make the most of making change for the better, getting rid of the bad, adding the good?
Yeah. If I could distill some wisdom on this and put it in a bottle and sell it, I would have retired many years ago. So there's a couple things there that I think are important to think about. The first is that I tend not to think of habits as good habits and bad habits. Now that's my own perspective. There's nothing necessarily right or wrong about that. But I don't think about good habits and bad habits for two reasons. One is that I don't like the binary thinking that it encourages. You know, some things are inherently good or inherently bad, and it just sort of creates this, you know, either or thinking. And behavioural change, as we know from our discussion already, is much more nuanced than that. There's pathways, there's processes, there's small steps, small stages. It's not simply a, you know, I'm doing this or I'm not doing it. So I don't think about habits in that way. I do think about habits, though, as convenient heuristics, if you like, that help us to satisfy needs that we have. This is why we form behavioural habits, because it satisfies at some level a need that we have. If you habitually drive the same way to work day after day, you're satisfying a need, and that need might be to minimise your journey time between home and work, for example. If you habitually buy the same food, you might be satisfying a need there for a particular flavour or a particular experience in eating that food, a particular sense of comfort that derives from that. Or you might be satisfying a need to know that you are taking a step towards managing your health well. So at some level, all habits satisfy needs. What can happen, of course, is that habits can lose their relevance to us. They become embedded patterns of behaviour that can be difficult to change, but they've lost their connection to something that was meaningful to us. Now, I will say that with food in particular, there are some particularly powerful cues that can make it difficult to change habits. We know, for example, that foods that have a lot of added salt, a lot of added sugar, and other things added to them can create spectacular, absolutely spectacular feelings inside your mouth. They can create a spectacular sense of satisfaction when you swallow them, when you taste them, when they first hit your tongue or the roof of your mouth. Those feelings are powerful for us, and that's one of the big challenges that we have in shaping behaviour.
Yeah.
Think about that feeling that you have when you've been working all day and then you get in your car or you get on the train to come home, and you've got an hour's commute to come home. You drop your bag, you shuck off your jacket, and you just collapse down into the lounge and breathe out a big sigh. Think about how satisfying that feels. And now think about what you need to overcome to get up, strap on your shoes, get out the door and run for 45 minutes. That's a big ask to have to do that. This is where ideas around the habit loop become useful. So the habit loop, broadly speaking, is a method of understanding behavioural change that consists of three elements. The first is a cue to act in a particular way. The second is the routine that we then follow after that cue, and the third is the reward that we get for doing that, which of course becomes the reinforcer for continuing that. So, for example, you and I talking, not long before a time of the year, or in fact at the time of the year when there's a lot of extra chocolate in grocery stores. So when you walk into the grocery store or the supermarket, you see these chocolate eggs at the front of the aisles, right on those aisle ends, the really prominent place. There's the cue. What's the routine then? The routine is, oh, look at that. I see there, 2 for $10, 2 for $8. And they're conveniently close to my left hand to pick up as I walk past. So there's the routine. And the reward, of course, is, when I get home and I've unpacked all my groceries, I sit down, pop one of these, little chocolate bombs into my mouth, and again have that experience of So now I've reinforced that behaviour. Next time I go back to the grocery store, guess what I'm most likely to do again. So the strategy, which is not an easy strategy to put in place, is first of all become aware of that loop, and become aware of likely those multiple loops in your own life. What are the cues you're getting? What are the routines you follow? What are the rewards that you get for that? You are unlikely to be able to change the cue. The cue is likely going to often be there. I mean, you have to go to the grocery store. Those little chocolate eggs are going to be there all the time, or at least for a part of the year. You're going to, when you walk in your house at the end of the day, your lounge is right there in front of you, and your big 65-inch TV screen with Netflix across it is right there in front of you. That's a powerful cue to sit down. We're not going to be able to change the cues. We can change the routines though. So, for example, changing a routine in the supermarket might be electing to follow a different pathway through the supermarket. The queue is still there, but you're now following a different pathway. So you're less likely to simply act automatically in that way that you have. You might strap your walking shoes on before you even leave work, so that when you get home, you're ready to go out walking. Or you might decide to change your routine altogether and come in the back door of your house, so you don't get that immediate response to the cue that's there. And the third part of it is being able to describe to ourselves different rewards that we might get. Recognize that there are other rewards available. What does it feel like when I've been out walking for 45 minutes? What can I connect with there? Can I connect with a sense of satisfaction? Can I connect with a sense of accomplishment? Can I connect with that sense of, kind of pleasant fatigue, not exhaustion, but just that nice sense of, yeah, I've done something. I've made my body work. And I really enjoy that. Can I connect with the pleasant reward of feeling a hunger for some good food because I've exercised? And if we can become really mindful of that habit loop in our lives, and mindful of our own capacity to, in particular, change the routines and the rewards, then we've got an opportunity to start shaping things at that kind of micro level in our own lives.
Yeah. And particularly in the field of positive psychology, to be able to associate positive emotions, those good feelings, that reward with the kind of behavior that we want. And you described that very well, the reward of that feeling of satisfaction of being out there in nature and walking, and how we physically feel at the end of a wonderful walk, and really instilling that memory of that, so that we'll start to lean more and more on that kind of a feeling. And I absolutely agree that we should, to the extent possible, avoid labeling any of our behaviors as good or bad, but often it just happens that way, because what we really want is to fully accept ourselves and have self-compassion with who we are, and that we all have our reasons for what we do. And as human beings, that's totally okay. And we start where we start, have self-compassion, and then through some of these tricks, if you will, and through the science, we can nudge ourselves in the direction that is certainly more healthy, more productive, and overall, it makes us feel that we're really taking good care of ourselves. So that's a wonderful description there, Simon. So as we wrap up, is there anything we haven't covered that you would like to cover, and some key messages you'd like to our listeners to take away?
I loved your reference just then, Liana, to self-compassion, and I think that's actually a really important part of this. Self-compassion matters, self-kindness matters in behavioural change. Step away from this idea of behaviours being good or bad. Step away from the idea of yourself being good or bad, or reliable or unreliable, or something like that. And instead recognise that you're doing the best you can with what you have at the moment, based on the experiences you've had to this point. And that means that you've formed some patterns of behaviour that perhaps are not as helpful or useful as they used to be. The idea of boot camping behaviour change is pretty popular. I think a lot of gyms still probably run boot camps. Having that stern kind of military-like person yelling at you and telling you not enough, do more, do more, do more. There's not really much compelling evidence to suggest that boot camping behaviour change helps us sustain behaviour change in the long term. It'll certainly elicit a change in the short term. If you feel self-conscious in a group of 10 people that you've done fewer push-ups than everyone else, that'll probably push you to do the same number. But that doesn't become a sustainable behaviour change for you over time, because it's not connecting to daily needs that you have. So self-compassion, self-kindness are really important. Staying connected to why this matters is really important. Staying connected to that need. Connecting with the accomplishments and the successes that you have had in other domains really matters here. Take an example of those from your own life. Recognise the success you've had. Celebrate that. Congratulate yourself and ask yourself, what can I learn? What can I learn from what I've already achieved there? And for me, probably the single biggest thing of all is the importance of not overlooking small change. Particularly when we've been, trying to make a behaviour change for some time, we tend to look for big steps as being significant. I need to be able to walk 5 miles, or I need to stick at this for 30 minutes. There's an old, I believe, Chinese proverb that says a journey of 1,000 miles begins with a single step, and this is true. If you're on the west coast of the United States and you face the east and you take just one step in that direction, are you now closer to New York? Well, undeniably, yes, you are. Also, undeniably, you have a long way still to go, but you have taken a step, and that step is in the direction that you want to go. So internalising that idea that small steps matters for me is probably one of the most important elements to stay connected to.
Yeah, absolutely. Focusing on what we have accomplished and really celebrating small successes, or even if we have a small goal and we didn't quite reach it, but we, again, made some progress towards that goal, that's something to celebrate and we should feel good about. And so, yeah, that the glass is half full approach, that positive psychology-based approach really helps us to not be afraid to experiment, as you've been describing, set goals for ourselves, move in that direction, and looking forwards to the positive feelings we're going to experience, the pride we're going to experience as we make change, even if it's very tiny steps along the way. Perfect. Well, any last thoughts to share on?
The only other final thought I would share, Liana, is that the best time to start making a behavioural change is now.
Absolutely. Start now. Well, thank you so much, Simon Matthews, for joining us. And thank you to our listeners for joining us in this Lifestyle Medicine podcast series. And hope to see you on another one of these soon. And take care, everybody. Till next time. Bye-bye.